Hi, I'm Dr. Joseph Wittering. It's my pleasure to welcome back Trudy. Trudy is an admin for the Lamictal Withdrawal Facebook page. I'm sure she'll give us the official name for that soon, but Lamictal occupies an interesting place in the psychiatric drug withdrawal and harm kind of communities in that at least from my vantage point, it's not given a lot of attention. You know, most people are talking about antidepressants, Cymbalta, benzodiazepines, but a lot of people are on Lamictal. So I asked Trudy to come here and kind of talk about her experience working with patients in the Facebook group that she moderates. What specifically the problems people have with Lamictal, and what is the kind of the pattern or the signature of Lamictal withdrawal. And so really excited to get her insights. So Trudy, welcome back. Thank you for coming, and I'll turn it over to you. Tell me, like, why do people end up wanting to come off Lamictal? How do they end up in that position? What's going on with them?
Thanks so much for having me back. I'm super excited for our conversation today. So that's actually an interesting question because people end up coming off of Lamictal for, probably a dozen different reasons. So you have your big glaring ones where they've started it, they've trialed it, and they immediately develop side effects. And the side effects require discontinuation. Lamictal has a black box warning for Stevens-Johnson syndrome, which is a life-threatening reaction. So sometimes people end up, just because they've tapered up according to how is recommended, they get the Lamictal rash, as it's called, even though it's not truly unique to Lamictal, and they get yanked off cold turkey because you have no choice. If you get that rash, you have to stop because it is life-threatening. So you have that group. Then you have the group of individuals who is developing more long-term side effects. So Lamictal is kind of interesting that you have a proportion of individuals that they take it for however long, and they have only mild side effects or perhaps not even anything they would complain about, and then they start to gradually deteriorate. And that can show up in the form of autoimmune disorders. It can show up in the form of cognitive problems, which was, one of the big problems I was running into. And there's all sorts of things. We have group members who've run into heart issues, liver issues, thyroid, like pretty much if it's a system of the body that can have problems, eventually it seems like Lamictal can interact with it.
That's really interesting. I'm definitely familiar with the rash, but the autoimmune things, things like the multi-organ hypersensitivity and things like that. These are all things. I'm looking at the label that you mentioned right now. There's also problems with blood as well, where you can become anemic, and it throws off the different levels of the white blood cells, even red blood cells, platelets, and things like that. And so, but that's it's really interesting that you mentioned autoimmune type conditions, because it's not something that in my training I ever really thought about. In fact, if I had someone on Lamictal who was on an autoimmune condition, I don't think I would have given it a second thought. So maybe I could kind of pick up that thread and just say, what are some of the things that you've heard, in the group? What do these stories look like when people get on the medication and they develop autoimmune type problems?
So it's really varied. And I think I want to kind of momentarily go to basics to give an idea of why the effects are so varied. So Lamictal's a sodium channel inhibitor, and sodium channels are basically, you can think of them as, for everybody listening, their communication path in your body. And so what Lamictal is kind of doing is it's slowing down the speed of that communication. And so over an extended period of time, you can start to develop all sorts of what I call downstream effects. So it's not that it's a primary effect of Lamictal, it's a secondary effect because the communication has been slowed down. And, the different cells of your body are very dependent on that communication. And so people respond differently depending on how it goes. But we see people who start having like recurrent shingles, reactivation of Epstein-Barr virus, like things like that, where clearly there's something going on with their immune system. And sometimes it starts before they start tapering, sometimes it starts while they're tapering. And so it's quite interesting. I would say it's probably the most mysterious effect to me. And I think it's because I'm obviously not a specialist in the immune system. So I don't have a lot of answers in that area. I've just seen it enough times to know that it's recurrent.
Mm-hmm. Wow. Okay. How long does it take someone to realize that Lamictal is causing a problem? Because I suspect that other physicians may not be so clued into, how varied some of these adverse reactions can be. I mean, I was wondering if you could kind of give me a sense of how long some people go through these things before they realize that it might be a Lamictal issue.
Years would be my guess. Like I would put it in the average of 5 to 10 years. We get people who've been on it just a year or just 18 months and they just haven't felt right since starting Lamictal, and eventually they kind of ping it back to these problems started after I started Lamictal, and they kind of connect the dots. Other people, because Lamictal has quite a profound numbing effect, so there's this certain loss of self-awareness that occurs with long-term therapeutic Lamictal use. And so it's very, I would say, almost impossible for the individual themselves to connect it and say, oh, my ability to remember people's names has really deteriorated over the last 18 months. Maybe that was a Lamictal thing. And so, kind of the common thread of people is, here's my list of symptoms, and they, give a laundry list of what they're dealing with. And then the next question is this being caused by Lamictal? I've had all this other testing done and everything's coming back normal, and I'm just, kind of that this is my last attempt at figuring out what's going on.
And well, I guess I have two questions. One, what is the Facebook group called that's the largest one for the Lamictal support? And then how many members are in there?
Let me look up our exact member count. It's not huge, because we do use Lamotrigene, which is the chemical name. So it's Lamictal and then in brackets Lamotrigene Withdrawal Support Group. And we're up to 2,300, just over 2,300 members right now.
Okay. How long has it been going on for, the group?
Oh, when was it founded? It was founded long before me, at least 2015.
Yeah.
So it's been around for quite a while. I've been an admin for 3 or 4 years now. So, yeah.
And when you're in the group, because I know from my work with the being in the antidepressant groups and the benzo groups, a lot of the people in there, they're not there for psychiatric problems. I mean, they've been started on the drugs for various other medical reasons, and it kind of gives a sense of how widely used these drugs are. But if you were to give me a sense of just what you see in there and talking to people, like where are the patients coming from? Are they coming from epilepsy? Are they coming from psychiatric problems? Like what are people taking the drugs for mostly?
It's quite a mix. So Lamictal is prescribed off-label quite a bit. So I'll lump all of the psychiatric problems together, even though it's only approved for bipolar disorder. It's prescribed off-label for depression and anxiety quite a bit. It's also prescribed off-label for migraines. And then you've got the seizure disorder individuals. And so I would say probably about a third of the people in the group have seizure disorders, and probably about half, I would say, are probably some sort of interaction with mental health. And then the remainder are like the migraines or maybe neurological pain. We've had a few members dealing with that. But the seizure folks definitely have a crossover in terms of withdrawal symptoms. But what's different about them is they're typically going on to another medication. Most of them have, a physiological need to be on some sort of medication to control their seizures. So they're in a little bit of a different situation than the folks that come in and are, took it for anxiety, or, took it because they were having headaches, or took it because they were diagnosed with a mood disorder. So there's definitely some variance, I would say, in the withdrawal pattern. And I suspect part of that is there's definitely a difference in support. So generally speaking, doctors, and I don't know the specialist, or probably a neurologist, I guess, neurologists tend to be a little more cautious about the taper process. They're maybe not aware of the full extent of the psychological difficulties that come with tapering, but they are aware of the physical difficulties. And one of the things that I think applies to most psych meds, but really applies to Lamictal, is that it's not just here's your physical symptoms, and if you get through the physical symptoms, you're going to be okay. There's, the physical symptoms, there's the cognitive symptoms, there's the psychiatric symptoms, and so you kind of have all of these different buckets of symptoms that you have to manage when you're tapering off Lamictal, if that makes sense.
Sure.
And even the people who are on it for seizure control, they can deal with, anger, rage outbursts, mood instability, or lability. And some people develop severe depression in the tapering process as well.
Interesting. I'd like to kind of have a dialogue with you about the psychiatric use of Lamictal, because I want to tell you about how I was trained to use it, and then see how it matches up, with your experience working with other people taking it for psychiatric reasons. So so Lamictal, I was trained to think about Lamictal as a kind of a medication for, I guess, sort of two things, maybe three things. So the first most common thing is a medication for bipolar depression was the first thing. So if you had someone who was kind of, or maybe just bipolar, like if someone who had a bipolar diagnosis, but you didn't want them on lithium or Depakote, or they hadn't tolerated those, you might consider putting them on Lamictal. Or maybe that they had like a kind of a bipolar 2, like a less intense bipolar diagnosis, and you said, well, I want to spare them the liver injury and the weight gain of Depakote, and I also want to spare them the thyroid toxicity issues and the kidney issues with lithium. Let's go ahead and put them on this safe drug. Lamictal, maybe it's a little less effective, but it's safe. The other place I've seen Lamictal be used is kind of as an additional therapy to like an SSRI sometimes, if they want to, have another antidepressant kind of effect in there, but they don't want to maybe use antipsychotic medication. I've seen it used that way. And I've also seen it used as a medication for borderline personality disorder. And for people that have a lot of problems with rage and irritability, it's kind of thought to be this soft bipolar med that could really make people, less irritable, and always thought of as being safer than lithium and Depakote, but maybe a little less effective. So that was my experience. What do you see, from your side?
I'm actually super fascinated by, so the first two that you mentioned are definitely things I've seen and heard. We've had more individuals with borderline personality diagnosis coming into the group recently, and I've been questioning actually, like, why were they prescribed Lamictal? This is completely off-label. But what you're saying, and when you think about, the general numbing effect that Lamictal has, I can see why that would be something you'd be told, hey, this is a good idea. And interesting, I feel like those individuals, and this could just be the effect of, this is a small circle of people, right? There seems to be a high comorbidity of anxiety and borderline personality disorder, that the individuals coming in with the borderline have both. And they've been told that the Lamictal will also help with their anxiety. And they're the ones that seem to have some of the most challenging adaptation to the taper process, I think is how I would phrase it. Like, they have a really difficult time tolerating what the taper experience is like. And it's, in some cases, it's impatience. Maybe they've done a huge drop and they think, oh, I'm going to wait a day or two and then I'll be better. And then, of course, you're not better in a day or two. And so then they kind of freak out. But you also have individuals who it's almost crisis causing. The experience of withdrawal is almost puts them into crisis, where some of them are seeking inpatient treatment, because they're convinced if they go inpatient that the doctors will be able to help them get through the withdrawal experience better. And it's really quite tragic. Like, I have a lot of empathy for the individuals, because pretty much universally, all of them have gone on it because they want to get better, right? They're trying to help themselves. They've trusted their healthcare provider, and their healthcare provider almost universally says to them, oh, this is a risk-free medication. It might help you. There's no withdrawal. Like, it's easy to come off of. It's well tolerated. And they're told all of these positive things. And so then they're kind of left high and dry when they run into those difficulties. And I think some of them who have been to, emergency and have gotten inpatient treatment, there's not a lot of help to be found. Usually they just end up on different medications.
You come out on some Seroquel, I imagine, would be what would happen.
Exactly, or Zyprexa or Risperdal, or yeah.
Yeah, it's so the thing about Lamictal in the personality disorders, and again, like you said, there's no medication in the US, at least, that has an approval for any personality disorder. But at least off-label, Lamictal is commonly used, as well as Topamax or topiramate as well, and sometimes carbamazepine. So all epilepsy medications. So there seems to be there's something about the effect that makes people less rageful, at least in the short term. And the borderline personality disorder population, I mean, you might as well think like PTSD. I mean, there's a slightly different flavor, but most of these individuals have had significant interpersonal trauma, which either kind of kicked off the borderline personality disorder or ends up being a cause of it. Because these are, kind of by definition, people with a lot of rejection sensitivity, very emotionally reactive, high anxiety, and that either their constitution or from previous traumas that they've endured. And then so you have that's just like where they function. And then, as we know about the withdrawal, when they're coming off the medication, that disability that they already have, where they're so reactive and so likely to see the world as threatening, it's almost put into overdrive. I mean, they were already disabled. Now you're going to be pushing them over the edge and
Yes.
really straining their relationships and a whole lot of things. So it's a very vulnerable group of people that I could see being especially at risk during the withdrawal period. And sometimes they're very suicidal as well. That's like another, because they feel so much pain.
Yeah, we get that every once in a while. Thankfully, not very often, because it's far outside what I'm qualified to deal with. And I sometimes spend a lot of time saying, please contact your healthcare provider, because, at the end of the day, they still need to have a relationship with their healthcare provider and actually have someone who's giving them that medical advice. Like, I think everybody involved in Facebook groups does our best to support our peers, but at the end of the day, it's still peer support. It's not healthcare.
Mm-hmm. So tell me this now. What is Lamictal withdrawal like? If it can be described with maybe broad strokes and the most, what would be the most common symptoms and experiences that people would have going through it?
I think, a very common experience is massive fatigue. Um, Usually, initially, anxiety worsens and then it improves. And a lot of people actually develop anxiety on Lamictal long term. So um, it's actually like causative of anxiety in some people. So they tend to have it tick up initially, and then once their dose gets down to a certain point, the anxiety kind of just disappears. And it's really different for every person because you have some people that come in and they're bound and determined they're going to taper quite quickly, and they don't report major problems. They seem to be okay. And then you have other people who are cautious right from the start, like they're making, maybe a 3 to 5% decrease, and they're dealing with extraordinary difficulties where, they're worried about how do I maintain my relationship? How do I continue being a parent? Like, am I stuck on this medication because I can't manage how I'm interacting with people around me? Um, I dealt with a lot of it when I was doing drop and hold. So I did a couple of different methods of tapering, but when I was doing drop and hold, um, one of my decreases, and I think it was the very first one I made, which was under 10%, like it was a 25 milligram decrease off of my 300 milligrams that I was on. And I had this inner agitation. Like I felt like I had to move constantly. I was just irritated. I couldn't, it was like this hypersensitivity, except for I didn't have words for it. And it's interesting looking back because if I was going to kind of give a broad strokes, what do I think was going on? My fight or flight got triggered. And so I was operating from that flight part of the brain or the body. And so I was not getting the rest that I needed. And you add all of that up with changes in sleep patterns, which I suspect the fatigue that develops is not actually caused by withdrawal. It's an entering of awareness of long-term fatigue. Because interestingly, when I started Lamictal, I said to my doctor, like, I'm feeling really exhausted. And she was convinced, well, maybe you have sleep apnea or maybe there's something else going on. Well, all of that stuff came back normal. As my dose got raised higher, I stopped complaining and feeling tired all the time. But then when my dose came down, I hit this point of just pure, like bone heavy fatigue. Like I had a week's vacation. I planned to clean my house and catch up on little things. And I ended up sleeping most of the week just to kind of get back. And I, in the end, sought acupuncture to deal with the extreme fatigue. And that was the only thing that really moved the needle because it allowed me to kind of learn how to start resting again.
Are you saying that you feel like the fatigue wasn't part of the withdrawal, but you were kind of awakening in a way and seeing how fatigued you had been the entire time on the medication?
Yeah.
Yeah, interesting.
That's what I think. So it's a super common complaint. In fact, almost everyone complains about the fatigue at a certain part of the withdrawal. And my belief is that the fatigue has been there all along. It's just you're so numbed. Lamictal is just so incredibly numbing that you don't have that self-awareness.
Yeah. Okay. And interesting. So we've got some fatigue there. Initially, some high anxiety. What else are people reporting as they go through the withdrawal?
Rage. Some people report high levels of rage, like yelling about things they wouldn't normally yell at. We've had people report like, they're they made their kid cry, and normally they wouldn't have ever yelled about something like that. And so it's very difficult for the individual. We get people who are severely depressed and if they're going at a not too quick of a rate for them, usually that dip lasts maybe 4 to 7 days. Like it's not a long-term dip, but we have one member in the group who went off quite quickly due to health issues and was at a relatively low dose. Like I think the point where this person stopped was around 50 milligrams, and they've developed basically they're currently disabled, and it's been over 3 years at this point. They shake, they have tremors, they sometimes have what might be seizures, and there's a whole host of, I'm trying to kind of stay vague to protect the person's privacy, obviously, but this person has tried a whole bunch of things. We have people that do like MRIs and CAT scans because they're convinced something's going to show up, right? Some of them think they're dying, maybe they've got a brain tumor or something. And for the most part, the only exception being heart issues, most of the testing all comes back normal. And I think because you had the label up just a little while ago, you may have seen there's now something in the label about heart issues or heart rhythm problems. I don't remember precisely what it is, but we've had a few people in the group now that have developed heart problems. And this was before the label was updated, because I think that update just happened in the last couple of years. And cardiac rhythm and conduction abnormalities. Yeah. So when I was put on Lamictal, that didn't exist. That wasn't known about. And we have people who, they wear Holter monitors for, a few days to a week to try and figure out what's going on with their heart. And so this is, in a way, it's a gift that it's on the insert now, because it means that the individuals who are affected, they don't have to keep fighting and say, like, I feel like something's wrong with my heart. They can actually point to, here's this side effect. Can you check if that's what's going on?
Trudy, these cardiac problems, how have you seen them reported? Do people develop like a rapid heartbeat or all of a sudden a shortness of breath and they can't, their heart is beating inefficiently, or do they have, they go into cardiac arrest? I mean, what have you heard from people who have developed, I guess, these cardiac problems in your group? Yeah.
So one person developed a bradycardic pattern, and there was actually talk about giving them a pacemaker, and they finished tapering off of Lamictal, and it actually improved. They no longer needed a pacemaker. But I would say the most common is people describe feeling like their heart's going to kind of beat out of their chest, or, they'll talk about lying in bed and feeling like, their heart just isn't beating properly and they think they're having a heart attack. And so this is something, it's not super common. Like we've got, since I just looked it up, 2,300 members, and I think we have 3 or 4 people that I'm aware of who've reported these problems. But I guess that's, in the world of effects, that's actually fairly common. That's about a 1 in 500, 1 in 600 report rate in the group.
And just to kind of ping off this this chapter, this label, some of the other things that are quite frightening is, some like look at these things. So we've got hemophagocytic lymphohistiocytosis and multi-organ hypersensitivity reactions and organ failure. Have you seen any of this stuff? Because this is not something that was at the front of my mind when I think about Lamictal, and this is really like these are immune problems. These are all of that autoimmune stuff.
Yeah, so we've
Yeah.
had a few people with elevated liver enzymes, and not like fatty liver disease type of things, but where it's like something's going on with their liver. So we've seen that turn abnormal, and in one person that I'm thinking of, they got off of the Lamictal and things returned to normal. So it seems to me from the limited amount that I've seen that if a person gets off, like if they catch it early and they get off, then the damage can be stopped. But yeah, there's definitely been more than one person who's reported liver issues. I think we've had some abnormal kidney functions. I honestly don't know anything about the hemophagocytic, but it makes me wonder, when it comes to people who are reporting that they're getting sick more often, if something's going on with white blood cells in there.
I mean, the top three things on this label, and the way these labels are constructed, it's by what the agency and the company believe to be the highest priority for the drug. And the top three things are all have to do with immune problems. Stevens-Johnson syndrome, a rash caused by a dysfunctioning immune system that causes the skin to become necrotic and fall off, deadly.
Yeah.
And then
it's like a burn from the inside out. Yeah.
Mm-hmm. And then we have this one here. This is also seems to be pathologic immune activation, causing coagulation problems, liver problems, and such. And then this one is kind of like a global autoimmune problem for all of the organs in the body, where you can get cardiac problems, muscle inflammation, liver inflammation, kidney inflammation, like these. So there's these global autoimmune things going on, the top three, and then going down, the cardiac problems, more of the psychiatric stuff, the behavioral things, aseptic meningitis. I mean, to me, that's again autoimmune type condition, inflammation of the meninges, not from a viral or bacterial cause. More of the withdrawal seizures. Yep. Interesting. Okay. Yeah. So I mean that's the label. So that's really fascinating. And okay. So we have cognitive problems. Some people have heart problems. And sorry, do you see these things flare up during the withdrawal period? Have you seen people develop cardiac problems or like autoimmune things as they're discontinuing? Yeah.
Sometimes they show up for the first time during the taper process. And so every once in a while you hear someone say like, oh man, I never should have started tapering because I didn't have any of these problems beforehand. Usually the medical advice these individuals are given once they show up is that they have to get off Lamictal. So they persist and they complete the taper. And usually the problems that have shown up improve. I'm not aware of anyone who has finished tapering and had like those types of issues worsen after they finish tapering. So it thankfully does seem to be fairly self-limited to that taper process, and then once you're off, it's like your body starts to heal.
Okay. The other interesting thing I wanted to ask you a little bit about is, well, first one comment which I'll say is that's actually that the occurrence of side effects during drug tapering is something very common with all of the medications. With the antipsychotics, sometimes the first time you see tardive dyskinesia is when you're stopping the drug. That's the permanent movement disorder. With the benzodiazepines, with the antidepressants as well, when you and the benzodiazepines, when you start to come off the drug, that seems to trigger the toxicity in it. So it sounds like similarly it may happen with Lamictal, but the I always used to think that it was only the benzodiazepines and the antidepressants that gave people kind of chronic, enduring neurological problems, like essentially like neurotoxicity. And that's what I like to call protracted withdrawal injury. I mean, there's standard withdrawal, which follows this normal linear course of recovery where, maybe when they finish their last dose, they're pretty bad for about a month, and over the next 2 to 3 months, the residual resolves. But then there's the protracted withdrawal where during the discontinuation of the drug, something just flares up and it damages the nervous system. And even after you stop the drug, the symptoms are still there. You can reinstate the drug, the symptoms will still be there as well, and that's kind of signaling something else. So I always thought that was just an antidepressant and a benzo problem, but I was wondering if you could kind of speak to whether you see that with Lamictal, people kind of getting injured from rapid detoxes and having enduring problems.
Definitely. Particularly, it's a much higher rate in the rapid taper group. So the official recommendation for how to discontinue Lamictal was written with an eye to preventing seizures. That was really all that it was tested for, was how do you get off of it without triggering seizures. And the quote unquote official recommendation is decrease 50%, and then a week later you can stop. And so we get a lot of people into the group who've they're either off completely following a rapid taper, or they've done that 50%, and they're suffering severely. And the tricky part is, and my understanding is this is similar with a lot of other medications, there's a percentage of people that they can go back to their original dose and they're fine. Like the withdrawal symptoms will disappear, they can stabilize, and then they can go off more slowly. But there's a small percent that if you increase when their body is already flared, for lack of a better word, they don't experience any relief, and sometimes it actually makes things worse. So you have this kind of impossible situation for anyone of like, what do you do? Do you increase and hope that you give some relief to the person? Do you stick it out and hopes, if they're still on medication, usually the safest course of action is stick it out, because you're not going to have the same degree of withdrawal as if you were completely off of it. Like, you have a little bit of protection because you still have the medication in you. But for the people who are off completely, you can't just jump back to your original dose with Lamictal, because even if you've previously been on it, that risk of Stevens-Johnson syndrome always remains. So you have if you've been off it, I think it's like a week, you have to start back at 25 milligrams. You can't just go back to 300 milligrams. And so there's all of kind of these complicating factors, but we see people that definitely are suffering months down the road. And, we've got a number in the group who are years since they've been off, and they're still struggling.
And when they're struggling, the benzo folks that I work closely with, they describe, they're not typical withdrawal symptoms. They have deafening ear ringing, tinnitus. Yeah, they've got neuropathy, they feel like they're getting jolted with electricity. They complain about their hands being numb and having strange tingling. Sometimes they've developed a kind of a dysautonomia where sweating has changed. They could be sitting comfortably in a sofa and the next minute they have a heart rate of 150. So they get this whole kind of group of strange neurological problems. What are the injured Lamictal folks sound like?
Some of those things that you mentioned actually have quite a high rate of crossover. One thing that I don't know if it's common with other medications is muscle spasms. People who've come off of Lamictal quickly, and even I did a slow taper, I had muscle spasms in my feet for a year and a half after I was off. And I would have weeks where it was fine, and then I would have clusters where it was like my muscles were just going like this, and it was incredibly painful. Like, it was so painful. And we see that. We see digestive issues. The types of food that people can tolerate really decreases. And it seems like most people have, around the 6 to 8 week mark, they have a digestive blip, if you will, where things just are not moving properly. The types of foods that are tolerated aren't a wide variety. And it can be quite distressing for someone who's either not able to keep food in or not able to eat. Sometimes they lose a substantial amount of weight. The other thing that happens, and I'm not sure the precise reason, is depersonalization and derealization. And I know we have one person in the group right now still dealing with that, and they're 8 or 9 months off right now. So they're not in like that 6 to 8 week window. They're definitely into a longer term period, and they're quite concerned. They're understandably, they keep asking, like, is this still withdrawal? Is this normal? When is it going to end? Because it's very difficult to feel so disconnected. And we've had a few, like one person I can think of who tapered almost cold turkey and developed a psychosis as a result. And so that's one of the things we warn people about is don't rapid taper, because like I have no idea of how to predict who's going to run that risk. But we have had people have seizures from rapid tapers. We've seen psychosis, like some really serious life-altering things.
And kind of moving on now, I want to ask, how do you recommend people discontinue Lamictal? I mean, yeah, what's the, I guess generally the advice that you think is like the most helpful for a safe taper?
So the general starting point is usually 5 to 10% from the current dose, and then hold that for a month. Some people can tolerate going quicker than that, and other people can't. Some people find 5% is too much. So I find it's a real challenge because a lot of people are very impatient. They want to get off right away, and they've been told it's going to be easy. So they think, oh, I should be able to, be off in a few weeks or off in a month. And so you're kind of, forever educating of like this 5 to 10% is really the fastest you can go. And learn what your withdrawal is, learn what your symptoms are, and what the pattern is. There was a chart that I think was on surviving antidepressants that I had downloaded, and it was basically a huge spreadsheet that you could track every single possible withdrawal symptom you can think of. And I used that in my own process, and it was super helpful to learn, like, oh, day 4, this changed, day 5, this changed. And you can kind of create this roadmap of, okay, if I can get through the first 7 to 10 days, then I know that things are going to turn around by day 10 and it's going to become more tolerable. So that's really, I would say that 5 to 10% is super important alongside learning your pattern so that you can really be purposeful in knowing when do I make the next decrease, when is it safe for me, what can I tolerate. Because I would say the only universal thing is that there is no universal rule. It's so individual for each person. We have a pretty good success rate with microtapering in the group. For the people who try microtapering, they find it doesn't help with the tiredness. It doesn't reduce fatigue symptoms, but it does reduce the most bothersome symptoms. So I think that's, I guess the biggest recommendations is go slow. And, we really push folks back to their doctors to get support in the prescribing process, and try and discourage, like, some people can't get that support from their doctors, so they end up doing it all themselves, but we really try and share ideas of how people can get their doctors on board, with, just because you can taper quickly according to the manufacturer doesn't mean you have to taper quickly.
Yeah, and that it can also be dangerous if you taper too quickly. That seems to be the most high-risk period for developing the neurological problems for at least the other drugs.
Yes.
What do you recommend for the spacing? How do people space it? I mean, if someone comes in on an XR formulation and they want to do a taper, do you find that people go over to the instant release and they dose, twice a day, 3 times a day, or they go compounding? Maybe you could tell me a little bit about how do you see people dosing during the taper process?
So most people are on the instant release, which for the average person, assuming you don't have any additional medications that affect the metabolism, is about a 24 to 27 hour half-life. So usually we encourage staying on the instant release. And if they're on the XR, we say, talk to your doctor about switching to the regular Lamictal. There definitely does seem to be an easier time tapering for people who are on AM and PM, so they've got a divided dose.
Okay, good.
And so I think it just creates a more steady state in terms of the amount of medication in the blood. So that's definitely a recommendation that we encourage, but I find that a lot of people are scared to divide their dose up when they've always been on one dose. So we have sometimes people accept that input and they make the change, and other times they just stay on the one. And we've had lots of people get off successfully on the one, but it does seem to be a smoother ride down, so to speak, when it is divided.
How does someone decide whether, that they know they want to do a taper? How does someone decide whether they want to do compounded or like dry cuts, like filing sections of the pill off, versus like a micro taper? How do you explore that with them? What are the factors that people consider when they pick the way they want to do this?
I find a lot of our members are educated in different processes. So they come in knowing about dry cutting, they come in knowing about dissolving their medication in water. Initially, so Lamictal is actually available quite easily in 5 milligram chewable dispersible tablets for the pediatric population. So we really encourage people to actually get a hold of the 5 milligrams and use the exact dosing where possible, because you can break the 5 milligrams in half. So you have fairly ready access to the 2.5 milligrams, which will get you a long ways through a drop and hold type of taper. We discourage using water to dilute it, because Lamictal doesn't truly dissolve in water. It'll break down into its components, but it doesn't stay suspended evenly. So we really encourage getting a proper compounding solution or getting it done at a compound pharmacy so that you're actually getting that evenness of dosing. And this is, kind of something I don't really hear talked about, but my own personal opinion is that I have some concerns when medication is diluted in water, and sometimes people use like that dropper process where they put it in water, they take a certain amount out, and then the rest goes down the drain. I have concerns about dumping raw medication into our sewer system or our water system. So that's also one of the reasons I really prefer that compounded liquid where you've got a jar that you keep in the fridge and you're only taking out what you need. I feel like it's a much better choice from an environmental impact perspective.
Having never done it myself, but to me it would make a lot more sense to do it that way as well, because rather than having multiple jars and solutions and things like that, you could just have it mixed up in an amount for a month. I mean, you might have a half a liter solution if you needed to, and then you just kind of pull out 2 milligrams or something like 2 milliliters a day, or you get these like those really tiny syringes, and you can kind of just pull it out, just squirt it in your mouth, and the process is done. Rather than I take the pill, I put it in there, I wait for it to dissolve, I shake it up vigorously, and then I immediately shove the syringe in there because I want all the particles to be suspended kind of evenly, and I pull it out, hoping that it's evenly dispersed.
Yes. And I've done that where like you're dropping the little pill in, you're putting the liquid in, you're watching it dissolve, and you're shaking up the syringe, and you're trying to get it into your mouth before it settles. And meanwhile, you can see it settling. So you're like, well, this is the amount I'm aiming to take, but how much did I actually take, right?
Yeah.
Like there's no way to know if you don't have that proper suspension.
And it's so tricky to assume that you can just do it with water, because I was... And this wasn't research, this was a casual conversation I was having with Nicole Lamberson, but she was saying that the majority, if not all of the benzodiazepines, with the exception of Librium, are not water soluble. And so, again, you would have that kind of same problem. Well, maybe the pill breaks down, but it's not really kind of dispersing into it. And people do that all the time. Every day they're doing these things, but the benzo community has started talking about using like milk sometimes, because a lot of the drugs are fat soluble, but sometimes that's not even readily available information. So you need to be quite, like, if you're going to do a taper like that, I mean, I think you need to be quite clued in as to where you're going to even find that information about does the drug dissolve in water or a fatty liquid, and all of that. But yeah, if the pharmacy does it, then they will know, the drug is going to dissolve in this solution, and maybe you kind of give it just a little bit of a shake anyway at the start. I don't know if that makes a difference, but I probably would do that anyway. And then, that's your solution, and then that's how I would do it if I was given a choice. That seems the easiest.
Yeah, and if I, was going backwards in time, if I compared, the water shake it up time to after I had a actual suspension in a, what they call a suspension vehicle, it was so much easier after I switched. Like I wished I had done it sooner, because it was that time that it takes to do everything. It's like soul sucking, because you're spending all this time taking medication when all you want to do is be done taking medication. So there's, a big psychological difficulty just in having to manage all of those pieces.
When you eventually did swap over and you started doing it with it, that's right. You ended up getting a compounded solution, right? Do you?
Yeah. I had one that was compounded at a pharmacy, and the other one, the pharmacy provided me the suspension vehicle, and then I made the actual suspension myself.
And was it OraSure? Is that what they give you, or is it Ora Plus? Or
I
something
had
like that?
Oral Suspend, which is the Canadian one, but it's pretty equivalent to Ora Plus.
Ora Plus,
There could be other ones around. The great thing is they're actually cheap to get your hands on. Like when I bought my last bottle, it was, I think, $15 at Costco's pharmacy.
And what was the milliliter of it? Do you remember roughly? It's like the size of a Coke can. It was a liter. Okay, great. So for a couple of months, maybe 3 months, you could use it. Yeah.
Yeah, my whole liquid taper, when the one that I made myself in the suspension vehicle, used 1.5 of those.
Yeah.
And the first one I got for free, because my compounding pharmacy gave it to me. So.
And they told you, they said, Lamictal, it'll work in this. It'll dissolve in this solution. It was like.
They were super helpful, because initially when I had been pondering, and I'm a thinker, so I thought about what is a microtaper going to look like for a long time, and in my head I was like, okay, this is the concentration of liquid that I want to make. Called up the compounding pharmacy, had a conversation with them, and they're like, absolutely, you must do 1 milligram equals 1 milliliter. And I was upset. I'm like, why? This doesn't make sense. How am I going to measure the amounts that I need? And then they explained it to me. And so I took the information I was given and followed the 1 milligram equals 1 milliliter. And then when I got into the smaller amounts, I went, oh, I get it.
It's a lot easier now.
Like, I'm so glad I took their advice. Yes. Yeah, it's the only way, because you can actually measure like a hundredth of a milligram using a 1 milligram equals 1 milliliter suspension.
Yeah, that's great. That's really good information. One day I hope to build a little document where we can kind of have all of the drugs and the compounded solutions that they would dissolve in, because a lot of people think compounding and liquid microtapers and they go expensive, But if it's, like you said, if it's something for like $15 for 3 months for the solution, and then you could just have your tablets, then it's actually very accessible to pretty much anyone.
It really is. And like the act of paying for a compounded prescription is much more expensive, right? Like if the pharmacy was just filling a compounded prescription, it costs much more because you're paying them to do it for you. But it was not expensive at all because you're paying for the medication, right? So you're just basically adding on the cost of, syringes and bottles and caps and like the miscellaneous supplies that you need to do it.
Okay. Well, that was a really good overview of the whole process. I know you wanted to kind of share some thoughts that you had over Lamictal mechanism of action, maybe some other topics. This might be a good time.
Yeah, so, and I apologize, I don't remember if it was after we hit record or before that you mentioned how, Lamictal doesn't get quite as much attention as some of the other medications.
No, it doesn't, yeah.
But I think there's actually a much higher crossover between what's actually going on for people who have Lamictal withdrawal compared to others. So I mentioned earlier about kind of downstream effects of the sodium channel inhibitor and how it reduces communication between cells. And one of those downstream effects in the brain is that it reduces glutamate levels. And glutamate, now you may have a better explanation than I do, but my understanding is glutamate is quite tightly connected in with the GABA cycle. And so and there's been research studies done on using Lamictal to purposefully reduce glutamate levels in the brains of people with conditions like ALS. So, on the research side of things, they definitely know that glutamate is affected by Lamictal. But the interesting thing is, if you have an effect in the body that's decreasing glutamate, well, that explains the anxiety that comes up as a side effect of Lamictal. It actually explains the long-term cognitive difficulties that can develop. And I think I didn't think to mention headache, which is a really common withdrawal symptom. But the increasing levels of glutamate as you taper, if you taper too quickly, you're going to get high levels of glutamate, which explains the headache. It explains why some people can potentially get long-term neurological injury from it, because it's kind of almost like a concussion syndrome of sorts, right? Like your damage from concussion largely comes from the glutamate storm that happens afterwards. So that's kind of my theory that I was curious to share with you, because I think in rapid Lamictal tapers, what's kind of going on in the brain, in part, is a glutamate storm.
That would make it very similar to benzodiazepines, because you have, you've got this kind of this yin and this yang. You have GABA and glutamate, with GABA being inhibitory and glutamate being excitatory. And so if the effect of Lamotrigene is to lessen the excitatory system, then maybe it's acting in a way like a benzodiazepine for some people. And just like you said, reducing it would cause this surge in glutamate that could be damaging and maybe even neurotoxic in similar ways that the benzodiazepines tend to be. This comes to another interesting point where I wanted to ask you, like with the benzodiazepines, usually the therapeutic effect is short-lived, but it's potent. In the first maybe 3 months or so, it's very relaxing. It helps people sleep. It's I mean, it's an addictive drug. It has a pleasurable quality to the intoxication for some people. What would you say are the initial drug effects, or maybe the therapeutic drug effects, or the helpful effects from a psychiatric standpoint? What, like maybe from personal experience of what you've heard from others, at least in those early days before the tolerance builds up?
I don't remember having any like marvelous euphoria types of like everything is wonderful statements, feelings.
No reduction in
Um,
anxiety or irritability or anything like that?
yeah, that's a hard question for me because I was actually started on Lamictal while I was getting the last course of ECT that I had.
Mm-hmm.
So I was given it and then it would be withheld the day before I was having ECT and then I would get it for a couple of days. So I wasn't started on it in the typical fashion. Um, and I I was very, I remember like once I got up to a therapeutic dose, I felt like this is a miracle drug. Um,
Sure. Yeah.
and it's kind of like the pattern that people have with Lamictal. If it is doing something in the early days and you're not having bad side effects, you think it's grand because, I'd been on lithium, it had taken out my thyroid and caused kidney problems. I'd been on Depakote, it had caused massive weight gain and migraines. I'd been on this laundry list of other medication, and Lamictal was really benign compared to that. Um, but there wasn't there definitely wasn't any kind of this feels great sort of feeling. I think it was more just I'm not suffering because of this, if that makes sense.
It's probably a hard thing to market, less suffering than Depakote and lithium. But I mean, that's kind of how I kind of think about it as well. Yeah.
It sounds bad, but I think it was, even after, like, because I knew years before I tapered, it wasn't doing anything.
Yeah.
But I just wasn't willing to go back into that merry-go-round of trying different things. So I decided, okay, this is as good as it gets.
Mm-hmm.
Um, and like I was on bus par from definitely 2009. I was on bus par until the point where like I tapered it at the same time as the Lamictal. So the anxiety definitely kicked up after I'd been on Lamictal for a period of time. And there definitely was a period where the doctor was increasing my Lamictal dose because it was like it seemed like it had worn off. So we bumped the dose up. And then I had worse side effects. So it ended up going back down. Um, so there could be a little bit of a tolerance aspect
Well, I was going
that,
to say that sounds just like the benzodiazepines, where in the short term they're potent drugs for reducing anxiety, but shortly thereafter people's anxiety gets worse. They have more ruminative, anxious thoughts, and the only way to account for that is that tolerance has developed.
yeah, and it's interesting because I definitely didn't have that kind of awareness. Like I wouldn't have thought like, oh, I've been on this for a long time and it's just pooping out and like increase the dose. Like that wasn't on my radar. So it's interesting to it's almost like it's a similar pattern. It's just not as condensed as what benzos are.
Interesting. Okay, good. Josh. Trudy, did you have any other thoughts or anything else that you wanted to discuss on Lamictal?
Well, I'm thrilled to have a chance to talk about it because it is, I feel like it's the forgotten medication. In part, I think because it has such a unique mechanism of action, right? So if I was a researcher and I was choosing something to research, I'm going to choose the big ones, right? Like I can research serotonin and it's going to cover like 10, 12, or however many different drugs versus Lamictal, which is like a one of a kind, right?
Well, Another thing that I'm curious about is there a group of people struggling with topiramate or carbamazepine, which are maybe a little less popular than Lamictal, but are still used plenty off-label for the exact same problems, bipolar disorder, borderline personality disorder, sometimes depression. Do those groups, do people coming off that get represented in any other groups to your knowledge?
We've seen people who have been on those other medications, but they don't talk about having had any difficulties stopping them. If I was going to pretend that I could, know things that I don't know,
Yeah.
I would say I would be certain that there has to at least be a small percentage of people who experience some sort of effect stopping them, because anytime you change something in the body, it has to have a trickle down effect, right?
Mm-hmm.
There has to be some sort of adaptation that occurs. And if you stop the medication that's caused that adaptation, your body's going to have to adapt again. And usually that's going to involve some discomfort at the very least.
Yeah. Well, excellent. Well, I want to say thank you, and I'm just going to ask you if you could see if anyone in the group wants to do an interview. I think I would like to give Lamictal sufferers more representation to kind of talk about their stories, because I feel like the more people who are having these problems who talk about their stories, the sooner it is to kind of almost recognize the signature of the withdrawals and differentiate them from different things. And I think it's a completely neglected area of study, and I guess we would call it psychopathology, is the field where we look at the patterns for things like depression and schizophrenia and such, but no one has really done that in any meaningful way for drug withdrawal symptoms. So if you know anyone that wants to talk to me about Lamictal withdrawal, I would love to hear from them.
Yeah, I can think of a few people I'll reach out to and see if they're interested.
Mm-hmm.
I do actually have another question, and I'm blanking on the actual correct letters. I believe it's the HPA axis,
Mm-hmm.
so the hypothalamus pituitary adrenal axis. Are you aware of medications that impact the HPA axis during withdrawal?
No, I'm not. Not really. I mean, that one is kind of like a mystery to me. I know of a lot of people that have hormonal problems during benzodiazepine withdrawal and antidepressant withdrawal, and so I don't know if it's hitting maybe that axis or if there's just downstream effects that I don't understand that cause women to stop having their their periods. A lot of the PSSD people describe genital atrophy, which to me must be hormone mediated in some way. So I know that the drugs have the potential to do something hormonal during withdrawal or toxicity, but it's not an area I fully understand. But please tell me why you asked that such an interesting question, Yeah.
It's very targeted,
Yeah,
right?
yeah.
Because it's something that I think is happening for a percentage of people, maybe not everybody, but definitely some of the people in Lamictal withdrawal. And it's something that I'm fairly certain affected me, where my body is very tightly tied to the times that I eat. And it's like I eat really healthy, but if I miss a meal time, my body I have no ability to handle irregular meal times or things like that. We do have people in the group who have similar to PSSD, like where they're reporting changes in their sexuality or the characteristics of their body. And yeah, so I was just curious of is this an off the wall theory, or is there maybe something to it?
There's something to a lot of these things. There's something to I think that there must be some similar mechanism for like a lot of conditions, not even just within psychiatric drug withdrawal, but even things like long COVID, which tends to look like protracted benzodiazepine withdrawal injury and antidepressant withdrawal injury, where they develop neuropathy and dysautonomia. Things like chronic fatigue and fibromyalgia seem to have these overlaps. And so I think there is, it's an interesting area, when you have so many different diseases that tend to knock out several parts of the body, in the way that drug withdrawal does, or some of these other conditions, or even vaccine side effects sometimes, something maybe autoimmune. But yeah, I think it's an area I don't know a lot about, but I know some people are looking into it to see what ties these things together and why seemingly different illnesses produce similar symptoms.
Yeah. It's fascinating.
Yeah.
Yeah, I've done a little bit of research on it and have come up mostly empty, aside from being like, oh yeah, so this affects these systems, but there's not really any like, what do you do if the HPA axis is out of balance? Like, that's not something I've been able to come up with an answer for.
Yeah, it's tricky. Post in the comments below, anyone listening to this, if you've taken any cortisol or testosterone or estradiol or any hormones, and if it's made any positive or negative effect on your symptoms. I think that would be very interesting. Yeah.
I know estrogen worsens withdrawal symptoms for people on Lamictal, but estrogen directly interacts with Lamictal's half-life. So I know that we see people come into the group who've been prescribed estrogen, and that's what actually puts them into withdrawal. They haven't changed their dose. They've just started estrogen.
Interesting. Okay. Well, I want to say thanks again for coming on. I'm sure I'll find an opportunity to talk to you again, but I really appreciate it. And thanks.
Yeah, thank you. It's been great.